Welcome to the On Your Mind podcast, where we are changing the mental health narrative, bringing hope and solutions. Here's your host, Timothy J. Hayes, psychologist.
Norrine Russell, PhD, is the founder of the Russell Coaching for Students, where they use an innovative method of coaching for complex students, including those who have ADHD, autism, anxiety, and learning disabilities. This innovative method, connected coaching, has proven successful for hundreds of students across the United States and Canada since 2009. Dr. Russell has been a featured guest speaker on over 25 podcasts focusing on attention deficit with hyperactivity disorder, including the podcast titled Additude, Additude. Well, Dr. Russell, thank you so much for joining us here today. It's nice to see you face to face.
Thank you for having me. I'm delighted to be here.
You know, I was hoping you could tell us a little bit about how you got into the work you do and what drives your passion for it.
Sure, absolutely. It's unusual work. So my career path first started, I was a college instructor, college professor, and my graduate degree is in developmental psychology. So I taught classes in developmental psychology and child and adolescent psychology. And then after several years of doing that, actually moved into doing nonprofit work full-time and helping to build healthy communities, healthy adolescents, healthy families. And then when I had my son in 2008, I decided to kind of retire from that work, and completely unexpectedly had several clinicians in town in Tampa, here where I live, ask me if I would start to work with some students. And they were students who the psychologist felt didn't need therapy, but they needed some mentoring, they needed some coaching, and really had not ever thought about that, but it was very consistent with the work I had been doing in the nonprofit world, and apparently was a need in our community. And so I said yes. And that's how I got started 14 years ago, was saying yes to requests from local clinicians for kids who really just needed coaching and mentoring. And now 14 years later, Russell Coaching is the largest student coaching practice in the country, and we specialize in kids who are complex. So they have ADHD and anxiety, or they have autism and anxiety, or they have dyslexia and autism. So most of the kids that we work with have 2 or more diagnoses, and we see kids all across the country. And it's been a really fascinating and rewarding journey, given that I started with no vision whatsoever of what I was doing or where I was going. To have ended up here 14 years later is kind of fun.
So when you say you see kids all across the country, is a lot of that done by remote, or are people traveling to see you, or are you traveling to see them?
We have 23 coaches at the practice, and they all see students virtually over Zoom. And our model works great. We actually started our model before the pandemic. And so we were on Zoom before the pandemic. And our method of coaching is pretty pragmatic and hands-on and practical, and translates really well to Zoom. Much different from like teaching over Zoom or therapy over Zoom or things like that. And so we haven't really had a hiccup with moving to virtual sessions. So you could have a coach in Virginia seeing a kid in Washington, D.C. You could have a coach in California seeing a kid in Indiana. And I think it's just really made the practice and what we offer very accessible to the kids who need it, and to the parents who didn't even know that something like this existed.
Wonderful. So you've also written a book about asking the right questions about ADHD before, during, and after your child's diagnosis, which is actually the title.
Yes, it is.
And
Yes,
when was that published?
published this summer, and really had, again, never thought about writing a book. Never wrote the book from my dissertation, just wasn't someone who, I didn't think I had a book in me. But after years and years of working with parents and teaching them how to better advocate for their student with ADHD, and teaching them what questions they needed to ask of various people on their student's team, the medical professional, people at school, therapists. I thought, you know, this would actually be a very handy book. And so we wrote the book to help parents really be better advocates for their kids with ADHD, because there's something just unique about ADHD where we don't get a lot of parent education when our child gets a diagnosis of ADHD. And so parents tend to sort of rely on the doctor or the school to lead the way. And sometimes that really needs to be the parent's role. And so the book is all about, how do you ask questions of the doctor, of the teachers, of the psychologists, so that you can become more fully informed and a better advocate for your student with ADHD. It's a quick read. It's very practical. I had someone this summer say, I can get in all my summer reading and read your book. I was like, great, good. That's what we want.
Well, and I'm greatly appreciate it because it's when you work in the field, you gain all this expertise, and then it's easy to start thinking, well, everybody understands this, and a lot of people have no clue. You write the book in such a way that you're letting people know what are good questions to ask even before there's been a diagnosis, and questions to ask to lead up to, well, should I have an evaluation? And then if I have the evaluation, then does that mean if my child gets that diagnosis, or I get that diagnosis, does that mean that then I have to have a medication? So it's you know, as you said, it's practical. It's a very practical piece of work. As somebody who's working in the field, do you feel as though the general population is getting better educated about this? Or is the general population just getting a lot of misperceptions? What's the trend you see?
I would say, in my experience, it's sort of interesting. I think that we are, as a community of people, as parents and as schools, getting better educated about autism, for example. I think while we have a long way to go with autism, I think we are starting to better understand the neuropsychology behind autism. We're starting to understand that, what can look like behaviors are really symptoms of a neurodevelopmental disorder. I think we're coming to a more empathic place for kids who have autism. I think the same is true for a lot of the mental health diagnoses, like ADHD, like anxiety and depression, especially since the pandemic. But I do think there is this odd sort of blockage in our American culture about ADHD and the science of what we know about ADHD, and that there is still, I think, very much a dominant philosophy that this is a behavioral problem as opposed to a neurodevelopmental problem, and that the cure or the fix is behavioral, and it's to become more strict, more harsh, to hand down more punishments. I think there's also, in some sections of our country, a real anti-science bias when it comes to trying to understand what do we know about ADHD. And I think that's hard for kids too. And so there's something, in my experience, there's something that's different about getting an ADHD diagnosis versus some of the other psychiatric disorders. And I think we are as a country, less interested in really understanding and supporting kids who have ADHD, which is particularly difficult for those kids who have not just ADHD, but they have ADHD and a mental health diagnosis, or they have ADHD and autism, because the ADHD is still really seen as a behavioral problem, which is not really in keeping with what we know about the science of it.
So the difference that you're mentioning would translate into what? The idea that people just get more harsh and try to put more structure on the person and treat it as though it's just a willful misbehavior?
Hmm. Hmm. I think that's what a lot of people still think, that the symptoms of ADHD are under the child's control. And in some ways, that's an understandable assumption, because we sometimes see the symptoms and then we sometimes don't see those symptoms. And so it can seem as though a child is willfully not listening, or willfully not doing their homework, or deliberately not cleaning up their room. But if we understood that ADHD symptoms can come and go, as with other things, right? Allergy symptoms come and go, asthma symptoms come and go. You can
Depression symptoms come and go.
exactly,
Anxiety symptoms come and go. Yeah.
exactly. And we don't say the same thing about anxiety or depression, like, well, you're just choosing to be depressed today, or you're choosing to be obstinate today. And so I think many people still feel like if a child works hard enough, they can overcome the ADHD symptoms, as opposed to realizing that that child is probably already working so hard to regulate their behavior, and in many cases not having success, and then starting to develop the pattern that we see in older kids with ADHD, where they start to possibly check out of school. They start to have concerns about, are they smart? Are they really, an okay person? Are they, just really, a lot of kids with ADHD end up with poor self-esteem and low self-efficacy, because they've been told, if you just try, you can conquer this. And that's not really the case. There are specific interventions and treatments that are needed in order for a child or a teenager with ADHD to thrive.
So one of the questions I had was, can you tell us what you think are some of the most prominent misconceptions about this? I think you've just handled one of them, probably the primary one. Are there other misconceptions about attention deficit disorder with and without hyperactivity?
I think there are several. I think one of the ones that I see commonly in my practice is the idea that medication should be a last resort as opposed to a first resort. Whereas if you take a look at what does the American Academy of Pediatrics and the American Psychiatric Association, what do those expert bodies say, and what does the research say? Medication should be first line treatment, not last resort. And I think that comes from parents' fears. And I don't really know where these fears get fed in our culture. But the idea that somehow if we treat this medically, the student won't learn how to handle it. They won't learn how to control it. Whereas in actuality, what we know is that, the medical treatment side of things, the the prescriptions that are written for ADHD actually help that child or teenager to regulate their behavior. And so it's a strange phenomenon that we have, where we think giving kids medication for something is going to take away their ability to solve it, sort of as if, you know, well, if I hand you a pair of glasses, you'll quit trying so hard to see. And I don't know where that comes from. I think another misconception that we have, and for some reason I hear this one all the time from parents, is that ADHD is somehow linked to intelligence, which there really is no correlation. You can have kids with ADHD who are very, very bright, who are gifted. You can have kids with ADHD who are just, kind of in the average, like most of us. But one of the things that parents commonly say to me is, he's very smart. He doesn't try, or he's not motivated. And I think there's an element, parents seeing their child's potential, their son or daughter's potential, and seeing how much they could do, except that the ADHD gets in the way. And so there's this strange misconception that, either all kids with ADHD are really bright or all kids with ADHD are not very smart. But there's some strange thoughts out there about the correlation between intelligence and ADHD. And then I think the other misconception, if I can add one more, is that kids with ADHD are not motivated because they choose to not be they choose to be unmotivated. Whereas if you really dig deep into the neurology of ADHD, you see that that's actually a symptom of ADHD. And so people have this misconception that, teens with ADHD don't care about school, or they don't care about their grades, or they don't care about their future. Whereas in actuality, that's just the motivation center of the brain running a little bit low for kids with ADHD.
I think those are excellent points. I think one of the things that I've seen over the years, we have people who are moderate to high level attention deficit disorder, with or without the hyperactivity, they can have, at least seemingly have, a lower set of social skills. Is the coaching that you do geared towards that?
We do sometimes address that. We have a lot of conversations with parents about the fact that kids with ADHD can be up to 30% delayed socially and emotionally. And you think about that for a minute, it makes perfect sense, right? If your brain isn't attending to the cues around you for social and emotional wisdom, right? And you're not picking up on those things, and maybe you're a little bit impulsive, right? Because of the ADHD. It's going to take a little bit longer to learn those social and emotional skills, and then to practice those social and emotional skills, right? I was talking with a mom last week about her 15-year-old daughter, and I said, they're really just their behaviors left over from when she wasn't treated and the symptoms weren't under control. And so when she was in middle school, she wasn't really attending to what were her peers doing and saying, and how were they behaving. And so because she wasn't attending to it, because she was distracted, which is, key symptom of ADHD, she wasn't able to internalize and start practicing those social and emotional skills. So, she's 15 and she still interrupts all the time. She talks quite a lot about herself. She doesn't express a lot of empathy yet for other people when they're having a hard time. And so I think it's important for everyone, professionals and parents, to understand that, if you have a child with ADHD, all the way through their teen years, they could be up to 30% or 3 years delayed socially and emotionally. And so they're going to need some support for that. They may not have an easy time fitting in with their peers, or they may use their ADHD symptoms to really be kind of the life of the party, but not getting at genuine, true connectedness in relationship. And that's another problem that sometimes we see that concerns me a lot. The kid who is the life of the party because they're hyperactive and impulsive and always a lot of fun, but not necessarily in a healthy, safe way. In our coaching practice, we do integrate learning social and emotional skills. We use the social emotional learning model, where the skills are self-awareness, self-regulation, social awareness, and then relationship regulation and healthy decision making. So we use a pretty common model that's used in schools called SEL, social emotional learning, and try to help kids to, at least have one friend in school, to not be socially rejected, to not be that kid who's inappropriate. And a lot of times, I'll be honest with you, that takes working in concert with whoever is the medical provider to make sure that symptoms are under good control. If you're have a neurodevelopmental disorder where one of the primary symptoms is can't pay attention and you're hugely impulsive, we've got to make sure that we have good symptom control so that you can learn the skills that go along with that.
Yeah, and it's fascinating when you say that. I just thought about somebody last week was bending my ear about how if somebody has Tourette's and they bark out swear words and they can't control it and they've got a tick that just keeps coming, we don't get angry at them and punish them for it. And right in line with what you're saying, it seems as though because the symptoms or the patterns of behavior are so much closer to normal, as you were just saying, most people just expect the person to manage it with, sheer will, or because I'm going to stack up the negative consequences so high that you're going to try to avoid them. So on the other side here, those are the misconceptions, right? That people think that there's an intelligence link directly correlated to attention deficit disorder, or that the medication should be the last ditch effort. What are some of the truths that people don't want to hear about attention deficit disorder and or hyperactivity?
I'm not sure if this is something that people don't want to hear, but I will say I think it's something that most people don't know, that ADHD medications are among the safest of the psychiatric medications and among the most effective. And so I think that sometimes people don't want to hear that because everyone says nobody wants your kid on meds. If the alternative is that you have a kid with ADHD that's untreated, you don't want that either, And so I think something people don't want to hear really is that you're going to have a decision to make. Are you going to treat the ADHD or are you not going to treat the ADHD? Either way, there's going to be ADHD. It's not like the choice is, well, we're not going to medicate and the ADHD is going to go away. So I think that's a difficult truth for a lot of people to hear. I think another difficult truth is that while diagnosing ADHD can sometimes be quite clear cut, getting medication correct, the dose and the duration, can be difficult. And that's hard for a lot of parents because you've just been through this long evaluation process. You might be getting a lot of negative feedback from school and teachers. You might see that your kid is socially isolated. The last thing you want to hear is that it might take 3 months or so to get the medication to a place where it's optimized, in the words of the American Academy of Pediatrics. And so, that I think is something that people don't want to hear. They if they decide they're going to treat with medication, having the patience to sit through medication trials and changing doses and changing medications so that the child feels the best they can feel, that can be really difficult. I think also there are a lot of parents who wish that ADHD would just go away at some point. Well, when will they grow out of this? When will they no longer need any of this? And the fact is that, research is not clear on that answer. Possibly 50% of people will outgrow their moderate to severe symptoms and be able to manage their symptoms without medication, but we really don't know yet. And so I think that's something that people don't want to hear, that we don't have the answer to, well, how long is ADHD going to affect my teenager or college student? Because
there's a part of that which is, you use the phrase outgrow, and as far as I'm aware, the jury is still out about whether or not people outgrow it or people grow into a maturity that allows them to apply their own coping mechanisms to deal with what's never going to go away.
Right.
This is just their way of interacting with the world, their way of perceiving, their way of ability to focus,
Yeah.
or their lack of ability to focus from time to time. Just like some people are going to have mood swings and or anxiety come and go. And I'm glad to hear you say that, because the idea that people outgrow it, apparently some do. But I think a lot of us who've worked in the field have more of an experience that by the time the parent comes in with the child saying, can you help me figure out if this child has attention deficit with hyperactivity disorder? The parents are clearly people who are dealing with this, and it's never been diagnosed and never been medicated, and they're functioning quite well.
Mhm.
But when we take the history, we find out they had a very similar history in childhood that wasn't aided by coaching like yours, or a diagnosis and medication, or, a 504 plan at school or whatever.
Right. Right. A lot of parents have that experience. And for some parents, it leads them down the path of, I want to make sure my child does have all of the components of good multimodal treatment. For other parents, though, they kind of get stuck in, well, I didn't need a plan at school, or
Right.
I didn't need coaching, I didn't need medication, and I'm doing fine, and that can take a little while to unpack, whether that's working with a doctor or working with a coach. How did you get through your childhood and your young adult years and adulthood with ADHD versus what's going to be best for your child or teenager? Sometimes the two are different.
Yeah, absolutely. And the question for some parents is, if I'm looking out for the best interests of my child, maybe they'll be okay, they'll survive like I did, but do I want them to have as hard a time as I did to get here? And how much further could they go if they had the support and, the benefits of treatment? One of the things I wanted to ask you was, do people only come to Russell Coaching, and it's russellcoaching.com, 2 S's and 2 L's. Do they only come to Russell Coaching after they've had a diagnosis?
Primarily, I would say we get people who have had, a psychoed eval, or they've had, an evaluation at school, and they have a diagnosis. We do occasionally, I would say maybe 10 to 20% of our practice comes because the pieces haven't really clicked for the parent. Marian's having a hard time at school. Her teachers are sending me notes all the time. She's a good girl. She's trying hard. I think she just needs, some help getting organized. And, we'll get started with our coaching practice, and then 9 times out of 10 suggest an evaluation so that we can see what's going on. And part of why that's so important, and we address this in the book, is that only about a third of kids with ADHD only have ADHD. The other 2/3 have something else that pairs up with the ADHD, whether that's a mood disorder, whether that's autism, whether it's a learning difference. And
Impulse
so,
control problems, yeah.
right, right. And so that evaluation piece is super important for getting the whole picture. And for us in coaching, it becomes really important because it helps us to understand, does this child have, fast or slow processing speed? How's their working memory? How do they do with, visual information versus verbal information? And we can kind of teach them, how does your brain work best? And then how can you, adapt to what you're being asked to do in school. So most of our kids come to us with a diagnosis. Many of our kids come to us still experiencing problems at school, problems at home. Parents who, unfortunately, for whatever reason along the path, haven't really been educated about what does multimodal treatment for ADHD look like, and what can you expect for your child or your teen when you have good treatment in place. So we do a lot of psychoeducation around ADHD, and then, of course, teach them how to ask the right questions of their doctor and their schools and their therapist and things like that, so that they can become really well educated about ADHD and therefore a good advocate for their child.
Well, and I think that that's one of the best aspects of this book, asking the right questions about ADHD before, during, and after your child's diagnosis. And it's with you, Dr. Norrine Russell, and Heidi, is it Condry?
Mm-hmm.
And I think whether it's this book or the coaching from people like you, that could make a really, really difficult process a lot easier. Having somebody who's been through it enough times that they know the kinds of questions to ask. That doesn't mean they're going to have all the answers for you, but boy, is it useful having a direction to go and these questions to ask to help you tease out, okay, what would be best for my child? Because as we know, there's as much variation in people with ADHD as there are people who have it.
Yeah. Yeah. Absolutely. Absolutely.
That's why you're talking about the multimodal treatment, and it's not just a one size fits all situation. As you mentioned, even after somebody gets the diagnosis, we're still learning, and it's this kind of very educated trial and error process to figure out which medication might help this person and at what dose.
Well, think about it, right? It's very different to have a child who has ADHD and fast processing speed and poor working memory, right? And maybe they have a little anxiety as well, right? Take that pattern versus maybe the student who has, what we think of as the inattentive ADHD or ADHD without the hyperactivity. And maybe they have slow processing speed, but they have a great working memory. And maybe they have, mild autism in there, those are two kids with ADHD who are going to present completely differently at home and at school. And so the ADHD diagnosis alone does not allow you to then predict and put on a track what this child needs. It has to be in the context of what do we know about their overall functioning. If you really want it, to be the most effective treatment that it can be, which I think is what we as parents and professionals want for all of our, kids, clients, patients.
Well, and the other, as you're saying that, I'm thinking about how I've seen such a tremendous difference, not just in the way people process, but if you've got an introvert versus an extrovert.
Mm-hmm.
So where that person gets the energy that feeds them and fuels them, and where they're having to spend extra energy, tremendous difference.
Yes.
If you have somebody who's an introvert versus somebody who's an extrovert, and on paper, it looks like the working memory is the same and the processing is the same, and whether they take in it better with optics or auditory, all those line up. But if you've got somebody who just gets overloaded in a crowd versus somebody who gets lit up in the crowd and they've got more energy to deal with things, you have two very different presentations.
Mm-hmm. You do. My own two children are complete opposites in that way. My son is just so extroverted, could spend his whole day talking to people, thrives on being around people. And interestingly, his medication helps him to control his impulsivity and over talking so that he can relate well to people. And I'm thankful that we have a great doctor and that she does a beautiful job of really controlling his symptoms so that he has that experience. My daughter, on the other hand, is wired a lot more like I am, very introverted. And what we notice is that she kind of, she's an introvert. She's definitely an introvert. That is her wiring. But the introversion combined with the ADHD, if she's not taking her medication, it's like she's even more blank, you know what I mean? And I'm an introvert by, anybody's definition of it, but it's interesting to watch your students who are introverted and kind of inattentive ADHD sort of wake up a little bit when the ADHD is controlled. And we definitely see that with our daughter. Is she still someone who prefers to spend a lot of time alone? Does she need to recharge by herself? Yes, absolutely. Does she spend a lot of time in her head? Yes, absolutely. But without her ADHD medication, she almost disappears into that.
Wonderful. Well, I realize we're getting a little short on time here. I thought I'd ask you to just take a breath and think about what's an aspect of what we've already talked about that you'd like to highlight, or something we haven't even addressed yet that you'd like to make sure we get into this interview.
I think that, one of the things that we haven't talked about is just how beneficial academic or ADHD coaching is for students. When we think about the fact that, we can have a kid who is up to 30% delayed, we can have those dynamics starting in middle school where, the parent-child relationship needs to be about something other than school. It can't be about the parent managing school, and that middle school time is when I think it's best to start coaching, because then we can help the parent really move into and stay in a parenting role where they are loving their child, they are supporting them through the social dynamics of middle school, through the emotional changes and upheavals. And for the most part, when our kids come to coaching, 95% of them love their coach. They love having someone to work with who is trying to understand their brain and how their brain operates, who is their cheerleader, who is helping them figure out how are they going to remember that they have a quiz every Friday in Spanish, what's going to work for them. And someone who has kind of an optimistic view of things. I think kids appreciate being able to work with someone for whom this is their profession, as opposed to kind of what we often see when they come to coaching is they're in a lot of conflict with their parent over school because they're not really doing as well as they could be, we would say, because we know that they're smart or bright or, want to do well. And so coaching is a really effective intervention for kids. And at our practice, we tell parents to expect that the intervention piece will be about a semester to learn, new skills, new habits, put those in play and really solidify them. And then some of our kids stay with us for a while after that. Many do actually, just for kind of the support and the mentorship and the parents' peace of mind. But, I think ADHD or academic coaching is not something that most parents are familiar with. Most parents think, oh, we need to go to therapy because they're refusing to do school, or they have a bad attitude, or we're yelling all the time. And so I think just in terms of something we haven't talked about, just raising people's awareness that coaching can be very effective for students. We're unusual in that we work with middle school students. I think most coaches work with high school or college age, but I actually love getting them in middle school because you can get all the good habits sort of ingrained in the beginning. And so I would just urge parents to be aware of, you don't have to be the executive functioning assistant for your student. You're not doing them any favors by doing it that way.
Which I would think for a lot of people, especially as parents, if they're having any experience with this at all, there'd be a tremendous relief.
Yes.
Because that's not their expertise, and it's a dual role, and the list goes on.
Yeah.
And as you said, one of the most important things is for them to be able to consistently communicate to their child, I love you, you're a good kid, you make good decisions, we can get through this. But if the parent's feeling overwhelmed and doesn't know how to help them through it, it you can see how it would easily transfer over into frustration and negativity. And
just at a time when that young person is going through a tremendous amount of changes biologically, emotionally, in terms of
socially,
schooling, socially, they need to hear from their parents, I love you. You are enough. You are exactly what this world needs as is. Well, it's hard to pair that message with,
why did you do this? Yeah.
Right. Like, why
What
do
is
you have all
wrong
these
with you?
missed assignments? Why do you have an F in biology?
Yeah.
Like, but I love you just the way you are. It's
Right.
like, well, of course that doesn't really work,
Yeah. Well, so I greatly appreciate your taking time to share with us and our audience. It's russellcoaching.com, 2 S's, 2 L's. And the book, so that I don't have to read the title, I have to pick up my phone and read the title. The book again is
Asking the Right Questions About ADHD Before, During, and After the Diagnosis. And it's available on Amazon in print and Kindle version.
Yeah, I got the Kindle, which is quite nice. So thank you for sharing with us. It's a delight to meet you. And I'm grateful that there's people out there like you doing this kind of work.
Well, thank you very much for having me on. I appreciate the opportunity and wish you the best.
Thank you. Norrine Russell, PhD, is the founder of the Russell Coaching for Students, where they use an innovative method of coaching for complex students, including those who have ADHD, autism, anxiety, and learning disabilities. This innovative method, connected coaching, has proven successful for hundreds of students across the United States and Canada since 2009. Dr. Russell has been a featured guest speaker on over 25 podcasts focusing on attention deficit with hyperactivity disorder, including the podcast titled ADDitude, ADDitude. With 20 years of experience creating positive youth development and parenting education programs, Dr. Russell has extensive knowledge of child development, learning styles, special needs, and positive parenting philosophies. She blends this knowledge to provide students and parents with comprehensive support and the tools they need to grow and thrive. Dr. Russell has a PhD from Bowling Green State University with a focus on psychology and education. Prior to starting her coaching and consulting practice, Dr. Russell worked at a variety of well-known nonprofit agencies, including the YWCA of New York City, the Tampa Metropolitan Area Y, the Ophelia Project and Boys Initiative of Tampa Bay, and the One Circle Foundation.
You've been listening to the On Your Mind podcast, offered by Journey's Dream, where we support people through mental health challenges to a place of true and lasting well-being. If you love our show, we invite you to visit onyourmindpodcast.org to join the conversation, access the show notes, and discover our helpful resources. Thank you for listening.